We're going to talk about the drugs that we use to help prevent and also to treat ulcers. And we've talked about NSAIDs and corticosteroids in the anti-inflammatory chapter. Just a reminder, they both inhibit prostaglandin formation. They do it at different sites, and so you definitely don't want to give them together because they will suppress that prostaglandin so much that you can really get some bad ulceration. We'll typically do a little what's called a washout period where we'll just take the animal off either drug for a while before introducing the other drug if we're switching from a steroid to an NSAID or an NSAID to a steroid, because we just don't want that double whammy on the stomach. And we also, just to bring back aspirin and being lipophilic in the stomach, it is partly hydrophilic there as well, but the lipophilic portion will travel across the mucosal cell membrane into those cells. The pH changes and it gets trapped in there, and so it can cause irritation. You'll see some of these pictures. They're taken with an endoscope. We have sedated the animal and then introduced the endoscope down into the esophagus, and we're looking in the esophagus and the stomach. These are stomach erosions. So this is the way that we can identify how much ulceration has occurred in an animal when we need to have a look down there. So antacids. Antacids in general are counteracting the acidity in the stomach, which is causing the ulceration. And so if we are anticipating, as I've discussed, sometimes animals get stressed in a hospital environment, and so we may give it in advance of treatment or as an adjunct part of treatment. So if we're going to increase the stomach or rumen pH, are they alkaline or are they acidic? So if you remember on the scale of pH scale, it goes from 0 to 14. 0 is very acid and 14 is very alkaline. And the stomach pH is normally about in the 2 to 3 range. And so what we're talking about is increasing it into the 3 to 4 range. We're not going to take it into above neutral, which is 7 pH. So just so you know that the rumen is naturally alkaline, so it's above 7 on the pH scale, and we're not going to take it down into the acid, or when we're trying to neutralize it, we're just going to make it a little bit more alkaline, and so increased above the 7 pH. We're going to classify antacids as either systemic or non-systemic, and the systemic type have to be absorbed by the GI tract and then come back around through the blood circulation to the GI tract and act in that way. But non-systemic or locally acting are going to act right in the GI tract to neutralize the pH. We'll talk about these non-systemic ones, locally acting ones first. These are some good old antacids that you may have seen in the store. There are Tums and Rolaids are very common, milk of magnesia, Amphigel. These come in liquid or tablets. They contain cations or electrolytes, if you want to think of them. So calcium, magnesium, aluminum, they all have these positive charges on them. And they just act chemically in the GI environment to neutralize the stomach, or neutralize the acid, counteract those hydrogen ions. So Tums and Rolaids act by having this calcium cation in them. Milk of magnesia has magnesium. Amphigel has aluminum. Now, calcium and aluminum tend to have the side effect of constipation. Magnesium tends to have the side effect of diarrhea. Somebody decided, hey, let's try a formulation with both. And Maalox and Mylanta and Digel were created. So they have both magnesium and aluminum. Typically we don't think that these cations are going to be significantly absorbed and worry about side effects from that, except for magnesium. It is absorbed and it's excreted through the kidney, so we want to probably avoid use some of the other types if we're going to use this type, because in renal patients, because it's going to be less excreted and it is absorbed. So we just want to be aware of that in renal failure patients. With the calcium type of antacids, we can get this condition called gastric acid rebound syndrome. So we give the calcium-based antacid. It has its effect of neutralizing the stomach acid, but the stomach is going to want to return to being acidic when we feed the animal. So gastrin will be released. That'll stimulate hydrochloric acid formation in the stomach. And once that calcium leaves the stomach, that gastrin and hydrochloric acid release will continue and make the stomach even more acidic. So we need to be careful with using calcium-based antacids. It changes the pH of the GI tract. That is what we're trying to accomplish. But we need to be careful if we're administering other drugs, and we need to time that. So typically what we'll do is we'll give these antacids. We may give another drug, I should say. We should give another drug maybe first, and then a couple of hours later give the antacid, because that'll allow, a couple hours will allow the first drug to be absorbed, and then once we give that antacid and change the pH, that drug will have already been absorbed out of the GI tract, and then we don't have to worry about its absorption. So typically a couple of hours between administration of an antacid and another drug. We also need to be aware of the calcium antacids if we're administering a drug that may be chelated. And we'll talk about this when we get to the antibiotic section, but tetracyclines are chelated with calcium, and so effectively taken out of the being absorbed. And so we don't want to administer tetracyclines with, say, cheese to try to get it into the animal. That would be not a very good thing to use as a way to get it into the animal, because it will chelate with calcium. But it would also, tetracyclines would also chelate with calcium-based antacids. So we have systemic antacids, and these are the ones that we reach for more, I would say, these days. They will decrease the stomach acid production in a different way. The first ones we'll talk about are H2 antagonists. So they antagonize the H2 receptor on the parietal cell, and they will effectively block that receptor from being influenced by histamine and slow down the release of the hydrogen ions. So they are cimetidine, ranitidine, famotidine, nizatidine. So these are the deans. They're otherwise known as their trade names: Tagamet, Zantac, Pepcid, and Axid. So you've probably seen them in the grocery store or seen ads for them. We have injectable forms. The prescription forms are the injectable forms that we'll use in the hospital. And then we have oral forms that we can send home with the owners. We'll typically stock these in clinics because it's much better to just hand the drug that you want the owner to have, rather than have them go to a pharmacy or a grocery store and pick these up. We want to give them what we want to give them. So they do tend to interfere with other drugs, and in particular some of the cardiac drugs. They will decrease the metabolism. So if they decrease the metabolism, what do we want to think about doing with the dose of these drugs or the second drug? Hopefully you're thinking in terms of reducing the dose, because if they interfere with each other, we're going to have a buildup of the drug if they're not metabolized and excreted. So another type of systemic antacid, and these are a really great drug because they tend to be better. If you remember, the H2 receptors on the parietal cell are only one receptor type. These cells are also stimulated to produce hydrogen ions from gastrin and acetylcholine. So if we can block the pump itself where the hydrogen comes out of the cell, I'm trying to point to it, sorry, the proton pump, then no matter what the cause or the stimulation of release of that hydrogen ion, we're going to stop it. So that's the idea behind proton pump inhibitors. Omeprazole is the main one that we have. Prilosec, OTC, which is over the counter, is a human drug. And we also have GastroGuard and UlcerGuard, which are in paste form. And the paste has a protective influence on the drug itself. So they are more effective than just the H2 antagonist because we're going to block the proton pump itself no matter what the cause of the stimulation. So omeprazole is, interestingly enough, degraded by stomach acid. So it comes in these capsules that then have enteric-coated beads inside of them. A capsule is good if you have an animal that's 40 pounds or over, but for those smaller animals, we may instruct the owner to open up the capsule and give them a certain number of the beads. With the other forms that are the veterinary forms, let me go back up to them, GastroGuard and UlcerGuard, these are pastes, and the pastes have a protective effect on the omeprazole itself. So a couple other ones that we use, this one in coordination sometimes with the proton pump inhibitor, sucralfate. So sucralfate is what's called a gastric acid band-aid. It acts directly on the ulcer. So once that top layer is gone, mucosal layer, this drug is attracted to the underlying layer of the ulcer and it forms a band-aid. It needs to be in a mostly acid environment, so we don't want to give it directly with an antacid. We'll wait and time it a little bit differently, but it will form this protective barrier, and it also stimulates the local release of prostaglandins into the stomach. We can crush this up and give it as a slurry. Sometimes we give it with yogurt. But it's a pretty interesting drug. It just forms this little barrier. And lastly, misoprostol, otherwise known as Cytotec. This is a synthetic prostaglandin type of drug. In the past, it's been very expensive, but we can use it sometimes with foals or cats because it's not that expensive. It does tend to cause, because it's a prostaglandin, it does stimulate the GI tract, and it will sometimes cause the side effect of cramping in the stomach. So we need to be careful with it. But it can be good, effective therapy. The other thing I want to make you aware of with this drug is it is a drug that can cause abortion in humans or in animals, and so that's a contraindication. Any humans, any women that are using this drug, are handling this drug, they should use gloves if they handle it at all. In some countries, this is a drug that is used for abortion. So I just want to make you aware of this pretty significant side effect with this drug.